Hello, and welcome to Mazars Healthcare Digest, Episode 19, Healthcare Surveys, Best Practices. I'm Sunshine Strong, a manager with Mazars Healthcare Consulting Group, and I'm joined by Pat Wong, also a manager within a healthcare consulting group. Today's episode marks the beginning of a series dedicated to healthcare surveys, audits, and assessments that will delve into the art and science of conducting surveys within the healthcare domain, explore different methodologies, uncover secrets of crafting effective questions, and talk about how to analyze the data obtained. In this episode, we'll discuss key considerations as well as leading practices when preparing for and administering healthcare surveys. In this video, we will briefly discuss an overview of surveys, methodology, stakeholder engagement, communication strategy, and using technology for better data and more efficiency. Pat, can you tell us a little bit more about healthcare surveys?
Yes, of course, Sunshine. So when you hear healthcare survey or audit, what comes to mind? You may understand the importance of providing high quality care. However, ensuring that your organization is meeting regulatory and compliance standards can be a daunting task. Surveys and audits are essential tools used in health plan operations to ensure that the quality of care and services offered and delivered is of the highest possible standard. Health plans conduct surveys and audits to monitor compliance with regulatory requirements and to help identify areas where improvements can be made. Now, surveys are usually conducted among members of the health plan or from doctors' visits to get their views on the quality of care and services provided. A general survey can ask patients about their experience with their health plan providers, hospital visit, doctor's visits, and how do these patients rate their experiences. A patient experience survey focuses on how patient experience or perceive key aspects of care, communication with your doctors, and understanding their medication and how well their healthcare needs are addressed. A patient satisfaction survey asks how satisfied they are with their care. Having said that, we cannot rely on patient experience and patient satisfaction surveys alone to determine how well the health plan or physicians are doing. Audits are also conducted on health plans' operations to determine whether they comply with regulatory requirements, policies, and procedures. Audits assess the quality of care and services offered and provided, financial management, and operational efficiency. Accreditation is one type of healthcare survey or audit to assess the health plan's commitment to meeting certain quality standards, compliance, and strive for continuous improvement. Health plans set out to be accredited by certain accreditation organizations, such as NCQA or URAC. Accreditation organizations do require health plans to conduct surveys as part of their compliance requirements. The results obtained from surveys and audits are critical in informing decisions about how to improve the quality of care and services provided by the health plan and doctors. This ensures that members or patients receive the best possible care while staying compliant with state and federal regulatory requirements. So for this episode of Healthcare Digest, we will be focusing on surveys. Audit readiness and accreditations will be covered separately in other sessions. So right now, let's touch on some of the best practices we should incorporate for each survey. So the first best practice, use established survey methodologies. Healthcare surveys should be designed using established survey methodologies to ensure that they are reliable and produce valid results. This includes using appropriate sampling techniques and question types, as well as pre-testing surveys to ensure they are effective. Accreditation organizations have a standard set of guidelines and assessment tools to assess health plans. These assessment tools serve as a guide for organizations to perform a gap analysis and identify areas of improvement. Medical records and file reviews are part of the assessment process. However, PHI is not used for mitigation purposes and to identify gaps and deficiencies. Confidentiality and privacy remain critical in all healthcare surveys.
Many times, health plans vary the methodology used and the data gathered over each iteration of a particular survey. This could be because of changes in regulation, but frequently this happens by not following guidelines closely or by changing the processes or vendor used. Mazars uses a multi-tiered checkpoint system with a sign-off by 2 senior staff at every step of the process to assure all survey methodologies are followed and are repeatable over each iteration, allowing data to be compared and mined for trends. Poor tool design can create bottlenecks in the data gathering phase of surveys and greatly impact the results. Our team has years of experience reviewing regulatory methodologies and developing tools to assure not only compliance with the requirements, but efficiency of use by users. It may not seem like much, but 1 or 2 extra mouse clicks on a survey page can add up over the course of hundreds of surveys. Being able to develop questions that gather useful and actionable data is important. Don't just ask, are you satisfied, yes or no? Get granular. If there is dissatisfaction, enable additional questions to drill down into the issue deeper. By using established methodologies and maintaining congruency with their processes, organizations can gather data in compatible formats over iterations of the survey to establish trends and patterns. These trends can be used outside of simply satisfying the regulators to improve efficiencies in healthcare operations. We have worked with health plans that have discovered a lack in education to their provider network based on the number of providers that simply refused to answer a survey because they didn't believe it applied to them. Once the gap was identified, a training module was developed and implemented. By adhering to the same methodology the following year, they were able to accurately determine if the training program had been successful.
Another best practice, engage the stakeholders. Healthcare surveys should involve stakeholders at every level, including patients, providers, and staff members. This helps to ensure that everyone's perspective is represented and provides a more comprehensive understanding of the organization's operations. Now, findings from accreditation and regulatory surveys require involvement and input from C-suite level all the way to employees to perform a gap analysis and determine the root cause and begin work on identified opportunities. When areas of improvement are not addressed, providers and patients are ultimately affected as quality of care decreases while posing safety concerns for patients.
Engage with your stakeholders early and often. Frequently, we find that everyone involved in a survey or audit is surprised by its arrival. When the health plan is unprepared, the data submitted can be hastily gathered and error-prone. When providers are not expecting a survey or are not sure what a survey pertains to, they will likely not respond. So engage your stakeholders early in the database planning stages. What is the data that is gathered going to be used for? Engage stakeholders across the health plan. Who is going to use this gathered data? Databases that house a health plan's data should be designed not only to serve the customer of a member, but also serve the customer of the health plan. Gathering the required data elements across multiple disparate systems can cause extra steps in making the elements compatible with each other and within the framework of the survey. Extra steps creates areas for error and corruption. We have encountered health plans that have their provider data spread across multiple systems, which were each maintained by separate staff, causing data elements for the same provider to be out of sync or missing altogether. By reaching out to all parties that may need to use your data, the health plans can ensure that it is easily accessible and relevant to operations. This is important not just during the planning stages of a survey, but also post-survey when collating findings, responses, and applicable corrective actions. By engaging in educational outreach to providers prior to the survey, health plans can ensure more participation. Having worked with health plans to develop mailers and educational materials to help their network prepare for outreach with a lot of success. When providers know what's coming, they are more prepared and likely to respond. More responses equal better data.
So what is the communication strategy? Provide clear and concise communication. It is important to communicate clearly and concisely about the purpose and process of the survey. This includes explaining the importance of the survey, how and who will be impacted, how they can contribute, and how the information will be used. The intent of surveys is to clearly address areas of improvement and for organizations to proactively mitigate any risks that may be associated. Now, the intent of surveys is not punitive unless egregious harm has incurred.
While it may seem like a no-brainer to keep up to date with communications from regulatory agencies, not everyone has the wherewithal to read regulation, nor think it's their responsibility. It's important to process the information from the laws and regulations and be able to communicate its purpose and intent out to stakeholders at all levels. Internally, health plans should know the why of what the survey is doing. The why is often to ensure better care for members or to ensure proper spending of public funds. The results of the survey should be communicated to business units in the health plan for corrective action plans where formal reporting is required, but also for continuous improvement opportunities outside of the scope of the specific survey. There is an art to being able to translate regulation into palatable language that is also actionable. Our team of experts lives and breathes compliance and regulation and can bridge the gap between technical legalese and the business, ensuring that everyone is on the same page. It's important to keep internal teams appraised of upcoming and ongoing surveys to allow them to plan for the impact to the business as well as know how they will contribute to the process. For providers, it can often seem counterintuitive to take time out of the day to answer questions on a survey as being beneficial to the patient. By engaging with your provider groups and keeping communication lines open, health plans can often find ways to gather the needed information without becoming a burden on the provider office staff. We can work with schedulers to have specific times for surveys, and through knowledgeable conversations, we can allay providers' concerns about how their data is going to be used.
So the fourth best practice is use technology to streamline processes. Technology can be used to streamline the survey process and improve data collection and analysis. This includes using online surveys, automated data collection, and data visualization tools to present survey results in a clear and actionable way. Survey process can take place in many formats, such as electronic, in other words, an online survey, sending mailers out, or even completing short surveys at the doctor's offices.
Really taking time to think about the survey process from beginning to end before anything starts is essential to a smooth survey. Being proactive, asking the right questions, digging into the processes, including problem areas, and engaging stakeholders at every level at the start will make it go all more smoothly. This includes working through the actual survey questions with the survey team and designing a tool that is intuitive and efficient for their use. Having access to a programming team to develop and maintain our in-house online survey tool has allowed us to customize our tools for each survey and implement efficiencies from surveyor input while in mid-survey. Using automated bots, such as robotic process automation, RPA, and scripting allows us to quality check data in real time and flag errors for review. Some common data error issues can be programmatically corrected much more efficiently than needing to be manually updated. Creating reporting tools that visually represent the data to stakeholders and having those tools accessible for self-service keeps everyone in the loop and the process moving forward.
So in summary, conducting surveys on health plans and doctors' visits help improve the quality of care, patient satisfaction, and overall organization performance. Surveys enable continuous improvement, ensures compliance with regulatory and accreditation requirements, and empowers members or patients with an opportunity to voice their concerns, opinions, and preferences.
Regulatory surveys can be disruptive to standard operations, but by planning ahead and adopting the best practices, that disruption can be minimized. A carefully planned survey can produce a wealth of data about your plan that is relevant and actionable. Join us in our upcoming episode that will delve more deeply into how analyzing the data gathered to satisfy regulation can lead to process improvements across the plan. If you are curious about how to improve your survey processes and results, or just have a question, please feel free to reach out to us. We are here to help and are always willing to listen and provide our advice.